Test really quickly.
Go for it. Test, test. So what's the difference between lipedema and just ordinary fat pockets all over your body? Hi, I'm Dr. BBT and I'm a double board certified plastic surgeon, and today we're going to talk about lipedema. So what is lipedema? Lipedema is a condition where you have disproportionate fat in your extremities, like your buttocks, thighs, calves, and sometimes your arms. But what's unique about it is that it spares the hands and feet, which is often one of the classic findings with lipedema. Often patients with lipedema have easy bruising, and this is because of the blood vessels being very brittle and fragile, causing the blood vessels to leak out a little bit of blood, which results in bruising. Another feature of lipedema is pain in the areas of fat deposition, which is different than just having ordinary fat pockets from poor diet or exercise. So who gets lipedema? Most commonly, women are affected. Men can be affected with lipedema, but it's rare. About 6 to 10% of the female population are affected with lipedema, and oftentimes it's related with hormones. For example, lipedema may develop after puberty, pregnancy, or other areas or other times in their life of increased hormones like fertility treatments. The correlation between hormones and lipedema strongly suggests that estrogen may play a role in developing lipedema. So what is the main difference between lipedema and just ordinary fat pockets? Well, everyone deposits fat differently, meaning some people, when they gain weight, may gain weight in their thighs. Other people may gain weight in their abdomen. Typically for lipedema, the extremities are involved, sparing the hands and feet, which results in something called a cuff sign, which means that your arms or your forearms are very large with fat, but then your hands are not very large, and that results in a look that looks like a cuff. Other people might develop symptoms like easy bruising, painful areas, which is not typical of ordinary fat pockets. The other thing that is very important is that despite exercise and a healthy lifestyle, lipedema does not go away, whereas traditional fat pockets usually tend to melt away with exercise and proper diet. So what are the different stages of lipedema? There are 4 stages of lipedema, all progressing from the mildest form in stage 1 to the most severe and advanced in stage 4. For stage 1 lipedema, the symptoms are very mild and sometimes not very obvious. There might not be a large area of fat pockets in the arms or forearms or even the lower extremities, but there's still some mild, easy bruising. There's some mild pain and tenderness, and the physiologic effects of lipedema are present, but it's just not very obvious. In stage 2, this starts to get a little bit more pronounced, meaning the pain might be a little bit more moderate, easy bruising might be a little bit more apparent, and you might bruise from a simple bump in the wall, which is not typical for most individuals. As we get to stage 3, this is starting to become more advanced, and you might notice easy bruising happening spontaneously, meaning without even bumping into anything. You might notice the fat pockets are a little bit more painful, a little bit more tender, which is not typical of the early stages in stage 1 and 2. As we advance to stage 4, then you notice easy bruising all the time that happens all out of nowhere. The pain is constant, and despite adequate exercise and diet, the fat pockets do not get smaller at all. So what are the classic signs and symptoms of lipedema? We talked about it a little bit with easy bruising and painful, but some of the things that patients also say they have when they have this diagnosis is that they notice that their legs tend to get a little bit heavy towards the end of the day. They might notice that their legs are swollen more as the day progresses. That heaviness makes it more difficult to walk and get around. And over time, by the end of the day, their ankles and knees and legs start to get a little bit more painful as they try to walk and move around. This obviously limits day-to-day activities and starts to get a little bit more cumbersome as they get older and as the disease gets more advanced. Some of the important things I ask my patients to determine if they have lipedema is if their symptoms start at the beginning of the day or it gradually progresses throughout the day. Another question is if they notice that their symptoms change with hormonal changes. So for example, in women, if it's related to their menstrual cycle, if they notice their symptoms began during puberty, or if a patient is on fertility treatments, if they noticed any changes of their symptoms during those fertility treatments. Another important question I ask my patients is, despite exercise and weight loss, the areas of lipedema stay constant. For example, If a patient lost 50 pounds, but their arms and legs stayed the same size and shape, that's a classic finding of lipedema, which means that no matter what you do at the gym or no matter what kind of diet you're on, and if you lose weight, the size and the circumference of your extremities, arms and legs, are staying about the same, that's usually a cardinal sign of lipedema. On physical examination, patients often have areas of bruising. It could be early bruising or it could be late bruising. It could be at various stages of healing. Sometimes patients will have tenderness in the fat pockets of lipedema. That is another classic sign. Another classical feature on physical exam is cuff sign. And the cuff sign is basically having fat that's in the upper arms and forearms, but sparing the hands. Similarly, in the lower extremities, having a lot of fat in your calf and ankles, but then at the feet, there's no fat, which again causes another cuff at the ankle area. Oftentimes, patients ask me if there's any imaging studies that could be done to definitively diagnose lipedema. Unfortunately, not really. Lipedema is a clinical diagnosis, which means based on your history and your signs and symptoms and what we find on your physical examination, that's usually enough to make a diagnosis. Ultrasound won't really show anything other than just fat pockets. A CAT scan is unnecessary, and again, an MRI is a little bit overkill because again, this is a clinical diagnosis. If a patient has something called lymphedema, which is different, a disruption of the lymphatic channels, then something called a lymphoscintigraphy is something that can diagnose lymphedema, but lymphedema is not the same thing as lipedema. Although it sounds the same and sometimes looks the same clinically, there are unique differences between the two that can separate them. So how do you treat lipedema? Well, if it's a stage 1 or mild lipedema, usually conservative treatments with compression garments are the way to go. These are extremely important to help keep the swelling down, especially as the day goes on, to prevent the swelling or the lipedema causing heaviness or affecting your day-to-day life. Compression garments are very useful because it will help restore your natural contour, but not only that, it will also help prevent the swelling to get out of hand, especially as the day gets longer. This is more of a preventative treatment because if you do not wear these compression garments, it's possible that a stage 1 can progress to a stage 2 or even a stage 3 if not properly done. Another really important treatment is something called manual lymphatic massage. Although the lymphatics aren't disrupted like in lymphedema, what we have found is that doing a massage will help restore the natural swelling in the extremities by forcing the lymphatics to drain the extra fluid and edema in these areas, and will help nourish the fat in a better way than if you never got a massage. These two conservative treatments are the mainstay of treatments for milder stage 1 or stage 2 lipedema. As we get closer to stage 3 and stage 4 and having more chronic, debilitating lipedema, more aggressive treatments are warranted. Surgery is more of a last resort. If you've tried conservative management and have not received any benefit or relief, you might be a candidate. So what is the surgery we're talking about? Well, put simply, it's liposuction. But it's not quite liposuction for cosmetic reasons. The reason why liposuction works for lipedema is that it removes the pathologic fat that's in the areas to prevent it from causing problems. The fat in lipedema is physiologically different than just ordinary fat pockets. The reason is the fat doesn't behave like it does in normal fat. Normal fat usually melts away with diet and exercise. In lipedema, it does not. Since it's recalcitrant to diet and exercise, liposuction is the only effective way to remove these bad fat cells. Since it's physiologically abnormal, no matter what you try to do with compression garments or lymphatic massage, if it's at the stage of stage 3 or stage 4 in the advanced stage, it's really hard to reverse the fat. So that's why liposuction is a very effective modality. So how does liposuction improve mobility and overall function and daily living in patients with advanced lipedema? Well, by debulking the areas, particularly the legs, patients are able to walk better because there's less bulk, less heaviness. Oftentimes, it also helps reduce pain. This is important because patients will feel like they're able to do more, walk more, and just do more day-to-day activities than they did prior before having surgery. What is the recovery after liposuction? Well, it kind of depends how much liposuction or how much surgery you're having. If you have very large legs and you have a lot of fat to remove, the recovery is a lot more than having just one small area that needs to be addressed. The longer the surgery, the bigger the surgery, the more recovery you need. Typically, 1 to 2 weeks is sufficient for recovery, and if you're working at a desk job, oftentimes after 1 week, you'll be able to return to work. Most importantly, you will need to wear a compression garment after liposuction surgery to prevent the swelling. Now, in the legs, since we stand and walk all the time, gravity will always bring the fluid down to your legs and ankles. For this reason, it's extremely important to keep your legs elevated for at least the first week or two to help gravity pull the swelling away from the lower parts of your legs. If you're having liposuction in your calves and ankles, this is particularly important because the swelling can linger for 3 or 6 months or even longer, depending on how much liposuction you had. Despite the swelling and probable bruising that you will have, the recovery is pretty straightforward, like I said, 1 to 2 weeks. However, the swelling may remain up to 6 months. The most important question people ask is, does insurance cover it? The short answer is, it depends. Maybe. If you have very severe symptoms, you've tried conservative therapies and you tried massage therapy and compression garment and it hasn't helped, and despite conservative treatments, you still have lipedema affecting your daily life and it progresses, you might be a candidate for insurance coverage for this surgery. This also depends on your policy itself, and every insurance company is different. Some may cover it, some may not. Some require certain requirements. So in summary, lipedema is different than just simple obesity. There are unique characteristics that define the diagnosis, and patients go through a lot more symptoms than patients who just have fat pockets. Physiologically, the fat is just different than ordinary fat pockets. The blood vessels that supply the fat are brittle and tends to break and leak, which what causes the easy bruising. This in turn also causes some pain and tenderness in those areas. And oftentimes patients have a lot of heaviness in their lower legs, and it affects them every day. It tends to get worse throughout the day. So if you have lipedema or you're not sure, call our office to make an appointment, and I'm happy to see you.